Right. Good evening, please. I need 1 or 2 people to confirm to me that you can hear me. Then I'll continue, please. 1 or 2 people, can you confirm if you're hearing me? If you can hear me, please just confirm that you can hear me.
Doctor, I can hear you.
All right. Thank you very much.
I can hear you.
So, all right. Thank you. Right. Good evening, everybody. Once again, you're welcome to this final meeting. And I'll be talking about reversing diabetes and hypertension this evening. So that's what we want to consider this evening, reversing diabetes and hypertension. So we want to understand how to go about this to achieve the purpose. So we look at my screen. I have some points to share with you, which includes what our topic is, then also includes what it means. So what does it mean to reversing diabetes and hypertension? What are the points to note regarding this? And I'm also going to be talking about some misconceptions and pitfalls. Then I'm also going to be talking about the way forward to achieving this. The way forward to achieving this. So the first point. So what does it mean? You need to understand that I've had different questions over the years. No, I remember some years back when we first started, there was a woman that got on the program. Then she went to the hospital and said she met a professor, and the professor told her that once she has this problem, it must be for life. So she should take her mind away from either reversing or not. That even if her blood sugar or blood pressure gets normal, it is still for life. So our emphasis was so much on for life, according to what our professor has told her. But my question, I really don't want to bother too much on answering her or saying too much thing. If it is between your head and your professor. So if the professor is sick, the professor will look for ways to deal with his own health. So if pleasing the professor is more important to you than doing what will bring back life to you. Now, does the professor have a point? Well, possibly he might have a point. I guess what he's trying to say is that according that there is no way out, because that's the general concept, but that still does not really define the concept. When you talk about maybe WHO, maybe you talk about health bodies and organizations, it's not true that once you have this, you must have it for life. As a matter of fact, one of the first things that is recommended in the hospital, when you go to the hospital, is some lifestyle changes. There's some patient that when you see them in front of you, you know that this patient, if he can change this or that, everything will come back to normal, not drug. The reason why doctors don't bother to talk about some of these things sometimes is because they think this person will not be compliant. One. Number two is that the doctor does not even have time as much. So when he discovered that this one would not even be compliant with what I want to say in all of this, just take your medications. So it doesn't bother to go into, or maybe just refer you to a dietitian and you begin to go up and down. So please, I need you to mute your mic. My system is limited today, and to be trying to mute mic for people will be difficult for me. Otherwise, I'll lose this slide. Please, let's mute our mic, please. So It's that's a misconception on its own. What it means to reverse diabetes, there is no need to start fighting over words. To be talking about, and does the patient have it for life? Does the patient not have it for life? Now, what are the main problem that is causing the diabetes? We have identified the roots of it, and that is insulin resistance. And there is a way your body will be that it is insulin resistant. Number one, if you are diabetic or hypertensive, that's an indication that insulin resistance is going on. Then talking about reversing it, by the time you start, if I ask one or two questions from you, I see you physically, even though your body, your blood sugar or blood pressure might have been come normal, I might still be able to see physically that by some medical understanding that I have, that your body is still insulin resistant. So that kind of a person who is still insulin resistant, uh, even though maybe by the fact that you have changed your diet and you are eating a better diet now, and it looks like everything is fine, it doesn't still mean that everything is fine for that kind of a person. Now, any slight change from what you have been doing for that kind of a situation, just discover that you are back to square one immediately. So what would that represent? That would just represent somebody that has not really been completed therapy. Therapy in this sense now is not necessarily drug. Like a program is a therapy, is a therapeutic procedure. Please, can you mute your mic, please? The program is a therapeutic procedure. So now we have many people all over the world that might be following this kind of a program. If they discover that their blood sugar or blood pressure has become normal and immediately revert to what they used to do before. And as a result of that, everything turns haywire again. And you go back to your professor and say, didn't I tell you? Yes, I told you. Yes, I told you. So that's one of the first misconceptions you must understand. You might start and you might be getting a good parameter. That doesn't mean that we have solved the roots, which is the insulin resistance issue. And how do you know if you have solved it or not? That's why we have a program that includes a special consultation, which I'm going to talk about at the end of the day. Number two is that let's even say that you have followed the program, because now talking about reversing diabetes and hypertension now is a program. Just bear that in mind. It is a program. That's the only way you can achieve that. And I've taken care of those points in the two previous days, that there is a way, like what I discussed yesterday was how to go on a healthy diet, just for your health generally. You don't even have to be diabetic or hypertensive. And if you are, and you do what I've talked about yesterday, what you will notice is that you are getting better. Your drug is working very well. That might not reverse the diabetes or the hypertension. But today's topic, which is to reverse diabetes and hypertension, you can only achieve that through a program. And when we mean program, you mean planning. Even if you are doing a do-it-yourself program, you must plan. You must have some details that is given to you to follow, and you are doing it as it has been prescribed. That's also a program. The second one is that we have a special program, which I think anybody that wants to reverse diabetes or hypertension, that's what it is, what is best for you. So on that program as well, we have I'm going to talk about program later anyway. Let me leave it. So the last point let me summarize the point I've been making. If you are diabetic or hypertensive now, your body is insulin resistant. That's the underlying problem. What we want to deal with first of all is to bring the body out of that state. Before we even bring the body out of the state completely, you begin to see improvement to the point that your blood sugar or blood pressure might become totally normal. At this point, many people will abandon what they are supposed to be doing. And until you ensure that your body gets out of that insulin resistance completely, any slight variation like this, before you know it, 1 month, 2 months, you are back to square one again. But if you are patient, you go through proper evaluations, and we know that, okay, everything is fine. The third thing is that doesn't still mean that you go on a reckless kind of lifestyle again. You understand? So you might be able to do a whole lot, maybe almost as you were doing it before, but now in a healthy way. Maybe diets, what you are eating before, but now in a healthy way. So that's the third thing. So number one is body is insulin resistant. Number two is that before the body gets out of that insulin resistance completely, you begin to see that everything is getting normal when you follow our program, either the one you are doing for yourself or the one that we are monitoring you. That's the second thing you discover. Then the third thing is that if, as at that time, you discover that you begin to do and undo, your body might not have been out of that state, you are going to begin to see problem in few months. Some people can even go for a long month before they begin to notice the problem. But if you are patient, you are well guided, everything well resolved, then you'll be guided on how to, yes, you are going back to your normal diet, maybe completely, but now in a healthy way. That's when I mean by healthy way, the healthy way that every normal person ought to eat normally, because whatever has caused the problem for you before, if you go back to the kind of recklessness in terms of lifestyle, in terms of eating that has caused it, it's going to come back again. It's just like getting the disease again. But now it might even be faster because your body is already triggered. But if you keep everything normal, normal eating, normal lifestyle, everything normal, I can guarantee you, you're not going to see that traces again till you die. If everything is, you're keeping everything normal. I mean, till you die by saying that means for a long time, you understand, everything is going to work as it is. So, uh, another, okay, so that's like the king of all the misconceptions. Among the misconceptions, that's the king. That's what you see that everybody are concerned about. Then the second thing is, what does it mean to reverse diabetes and hypertension himself? Now, let me explain to you, to give you the instance between two different people and the results that the two people can expect. If you are reversing a car, let's say there is a gate through which you want to get that car out, and you have two people. One of the car is 100 meters away, and the second one is 50 meters away, and you want to reverse out of the gate. So, which of the two cars will first of all get out of the gate? Please, can somebody answer me on that? Two cars want to get out of a gate. One is 100 meters away. The second one is 50 meters away. And all things being equal, the same speed, they want to get out of the gate. Which of the two will get out of that gate first? Can anybody please answer?
The 50 meters.
All right. Thank you very much, ma. So the first one that will get out of the gate is 50 meters. In fact, it's so simple that even the baby that is listening to us knows the answer. And you see, it's just a simple common sense. But as simple as that is, you will see somebody who's maybe 2 or 3 people are on the program together, and the other people are already seeing changes. Maybe this other person have not seen. Will be like, what is going on? Blah, 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 blah. Everybody, their own is working, my own is not working. The reason why your own is not working is simple. Your car might be 100 meters away, and this other person is 50 meters away. So it doesn't mean you are not getting better. If you get on the program to reverse diabetes and hypertension, I'm talking about our home program now. The first thing you first of all notice is that your overall health blossoms. You just discover that you are feeling fine. At least that's what almost everybody has reported. And that aside those who did not report. So can also believe that they too, if hundreds of people have had that experience, even those who we did not hear from will likely have the same experience as well. So, there are many symptoms that come with all this dysfunction, malfunction in your body. What you first of all notice is that all those things get resolved. Suddenly, the energy level increases, normal increase. I'm not talking about normal increase now. Then you begin to see uh people who have pain all over their body begins to get resolved. They feel better in their body. Then people who have difficulty sleeping, many of them report sleeping well. That is the first thing that I know that is experienced. And that because this problem is happening at a metabolic level, and there is a way that the metabolism in the body is getting controlled, becoming well, and everything is becoming fine. So the patient feels well overall. Then next, after that, all these changes that I'm talking about within a week of being well committed to the program, people see these changes. Then next after that, you begin to see that your parameters are coming down. I mean, people who usually need medications to bring the blood sugar, blood pressure down, and yet the parameters are high. They discover that with that same medication, they are experiencing normal results. They might still have to use the medications, but the next thing they discover is that normal results of medication, and which is not their experience before. Before, what they are struggling with is that their medication is increasing and the parameters are not getting normal. But now the parameters are getting normal, then they require less medication. No, sorry, then the medication is working, unlike what they were experiencing before. At this point, many people also make mistake. That's when you discover that people now become their own doctor. Just a few minutes of because those who come on the program, I usually give them an unofficial access for consultation. Just within 1 or 2 minutes, ask a question, you are directed. People don't do that because we feel we are fighting devil, and because we are fighting devil now, at that point, instead of people to see that okay, what they are doing is working, begin to hear some people say that God of so 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 is fighting for them. The God of so 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 that has not fight for you. So I'm not against the God of whatever, a believer in Christ Jesus, you know. But what I'm saying is that there are some common sense that God has given us, and we are using that common sense, and we are supposed to continue. Even if you say it is God of so so so, because God of so 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 might be the one that has helped you to get the information. But what the God of whoever you are referring to is helping you to achieve is to got the information, and why you use the information is working. Then that's when you begin to see, to say that it is God of this that is fighting for them. Every common sense thing they were doing before they will leave you say, the anointing service last month really worked. But why has the anointing service not worked for the last 5 years? That before you come across that kind of program. So we ought to give thanks to God in everything. And in this case, how do we thank God? We thank God for bringing you across this program. And because God has brought you across the program, and you know it is God that has helped you to find a program like that to deal with your problem, you are supposed to be committed to it. Not that you will leave what is helping you, and the next thing you are doing is drinking anointing oil because you say it is the God or so, so, so. It is not the program. So, because you have experienced a little change. So, it's another common sense that must be applied. When you begin to get results, everything becomes normal with your drug. Don't throw away the drug at that point. You need a medical personnel to guide you, because in hospital, we don't say that you must continue using drug by fire, by force. If we discover that there is a remarkable change in your parameters, the doctor will look at it. It might not be that it will reduce your medication. What you might have to do is to change it to another type. Because the reason why you are using that one in the first place might be that that is the only solution. Maybe that is more potent for your stage now. Now, you have not even given opportunity to benefit from sound medical reasoning to change the drug. And if the doctor changes it and maybe you continue the program, you begin to see that everything is becoming good again. And the doctor says that it changes the drug again until you don't need medication again. And we have also done that for people. But personally, I'm not in a rush to change to remove medication from people because that drug also have good that is doing. The only thing we don't want is that we don't want a situation where you have to be on it for life. And as much as possible, we want to see how to reduce it. But we're not just going to say, well, throw your drugs away. It is difficult, it is painful. See, if you have had diabetes for up to 10 years and you are taking drug and you are feeling and then you are still alive, everything still working, thank God for the opportunity to take that drug. Because I bet you, if you have not been taking that drug, things would have gotten bad, except you know what to do. Like coming on this kind of a program, things would have become very, very bad. So the drug is not evil, but the only thing is that drugs have its own side effects too. And one side effect of drug that's common to everybody is that it is costly. It is costly. You have to keep paying. And over the years, when you calculate what you have spent on drug, maybe you have spent ₦1 million on drug. So that can be taken care of, but it is a gradual process. So we have had hundreds of people that we monitor on our program that gives us feedback. And among this, I can tell you remarkably, a lot of people are out of medication, especially those who are committed to the program. So now, what it means to reverse is that it's going to come back. When you begin to see that you are improving instead of it progressing and getting worse, you know that what you are doing is working. So you want to stay committed until you are given a pass and say, okay, madam, sir, everything is fine. Now what you need now to be doing is make sure you maintain the lifestyle, your normal diet. But people usually don't give themselves that opportunity because of too no, I too sabi. After things gets good a little, you feel like, how do they even know, Jerry? Is it not, it's because I was eating well, I was doing this. It's not just because of that. And even if it is, even if that is just the reason, one simple advice, medical advice, based on what you are doing, can change the whole thing that you might have struggled for 10 years. So when you take things in your own hand, it's not going to be like we have to sit you down for days and be pumping information so that we can say, we are really helping this person. But how you will look from the eyes of a layman is different from how somebody that have been trained in medical profession for 10, 15 years will look at it or more. So it's different entirely. So one thing that you will take you 1 year. We'll just take that person maybe 1 minute to tell you this and this and this and this. This is how you should go. And you'd have saved yourself a lot of stress just by doing that. So what is the way forward now? The way forward is to there are different class of people. There are some people that are hypertensive, there are some people that are diabetic, then there are some people that we have that are pre-diabetic. Some people also they are at the borderline for hypertension. If what the problem you have is like pre-diabetes, for instance, and I put an exercise program on the group. If you follow the exercise program, change your dietary lifestyle, you're going to see a lot of improvement. In fact, things might come to normal. We also have two categories of program. The first category is just a dietary program. When you come on that dietary program, we give you some information. I have recorded videos that you will get. And that video deals with things like hormonal problems within the body. There's an hormone we call ghrelin. There's peptide YY. There's leptin. There's a way to deal with this hormone in terms of dietary modification now and lifestyle modification. When you do that, these hormones are actually the ones that are imbalanced between themselves. When these hormones remain imbalanced, they are going to experience all of this problem. But when it is dealt with and everything becomes balanced as it ought, those are the mechanics by which begin to everything works. And it's not what I can just sit down here and explain. I have pre-recorded videos that explains how to deal with such, and it is part of our dietary program. So people that comes on the dietary program gets that. Also, we talk about high blood cholesterol. Either your blood cholesterol is already high, or you want to prevent it, because once you have diabetes or hypertension, and especially if you have both, it's almost like what you are going to get if you don't do what you're supposed to do. In our dietary program, we also have an information on how to deal with that and practical things to do so that your blood cholesterol, if it is already high, it comes to normal. If it is not high, you prevent it from going up further. So, yes, some people have lost weight so much that they are afraid of losing weight again. Well, we have an information on what you need to understand. Some people have tried all the best to lose weight, even on the dietary program. There is a free information on how to go about it, and not just information, we guide you as well. Once you do what we guide you on the program regarding that, uh, people lose weight remarkably who wants to, once they do what we ask them to do. So there is no need, what's God, it's just like a bonus weight loss program. Everything is incorporated, and it is not even as it is been, this Wahala weight loss program where you have to starve to death. That's not what I'm talking about in this regards. So then we have another program, which is diabetes and hypertension intervention program. Now, the difference between these two is that, okay, for the first dietary program as well, we have lifestyle program, exercise, schedule, advice on exercise. Then on it as well, we have when it comes to advice on fruit and all the rest. Now, I want to, okay, let me leave that for now. So, what's the difference between that and the diabetes and hypertension intervention program? The difference is that on that diabetes and the hypertension intervention program, you get everything that you get on the dietary program, number one. Then the second thing is that we monitor you. So we have a special group that is created for that purpose. Then number two is that we reach out to you from time to time to give you a guide. Then you can also reach out to us. Then the next thing is that after you have gone on the program and we get feedback from you, we help you in terms of getting off medication. So usually this is what you do with your doctor, but we still give that assistance because the situation of even getting to the hospital now, or maybe, there are many bottlenecks regarding that. And this is just what we do for our clients on the program. So when you get a diabetes and hypertension intervention program, you are our client for 3 months. For 3 months, because that's the minimum duration we think you should pay, give what's got attention to the program. So within that 3 months, we are going to be engaging with you, and likely you will be able to reach us. Likely you will be able to reach us. I've had people that want me to be the one that will be calling them. So that's not it, so that I can clarify that from the beginning. Yes, I'm going to be giving an offer at the end of this, and there is a bonus I want to attach to it, and that's a uh, coaching bonus, such that we get some professional works with us, and want them to be able to you to benefit from coaching in that regard. So let's go forward now to Now, I talked about this yesterday, glycemic index, glycemic load, and second meal effect. So when we are dealing with the dietary program, which is also part of the diabetes and hypertension intervention program, we put all these three into consideration. And not just these three, there are many more. I've talked about some of it. Hormonal control, talk about ghrelin, leptin, peptide, YY. So we put therapeutic fasting. We put at least 10 different principles in making the meal plan, because those who come on the dietary program are going to get a meal plan and a meal guide. The difference between the two is that with the meal guide, you can make your whole meal plan by yourself, or you can choose what you want by yourself. The meal plan is like a program planned out that will advise you follow for some time. It's not just a meal plan, just like the way we do it at home. That, okay, we eat this today, we eat that today. It's actually a program, detailed program, so that you have to follow, and it is designed to correct metabolism and to correct many other problems that might have been going on within the body. So this is what I've been talking about since our services. I talked about dietary program, then I talked about diabetes and hypertension intervention program. So the dietary program, as of now, because it is on discount, costs 12,500 naira. So usually just the dietary program costs about 25,000. And I mean dietary program without any support that we give, like I mentioned. But we are giving, but now it's on discount, 12,500. Diabetes and hypertension intervention program costs 25,000 per month. And that's for 3 months. So that's 75,000 naira for the 3 months. So if you want to come on the program, and uh, but if you are going to take action on time, so because that's going to save a lot of stress, I'm going to be giving out discount, but this is a time sensitive discount. It is just for those who are coming on board immediately. You can always come at any time and join this dietary program 12,500, or the diabetes and hypertension intervention program 25,000 per month for 3 months. But I want to do something for those who are coming, and I will be the one that will be personally dealing with those people. So I can only take an handful. Now, I'm not the only one that conducts this program. Yes, I'm the director of the program. I'm the one that is leading, but I want to get some client that I will personally deal with, and I'm giving those people offer, and I'm going to bring this program further on discount. And the discount is for those who are getting the dietary program alone. Instead of 12,500, they pay 9,990. Then those who are coming on the diabetes and hypertension intervention program, instead of 25,000 naira per month, you pay one time, and you pay 25,000 naira for that one time. So now, like I said before, this is not what the program goes for. And this is just for people who are taking fast action. We are enrolling people immediately, and by Wednesday, we want to kickstart this program. Now, there are limited number of people I can deal with personally, and for this discount, anybody that comes on this discount, I will be the one that will be dealing with them directly. Yes, some people are working with me that will deal with you too, but I'll be the one. Then this other service that is 25,000 per month for 3 months, if you don't come on it immediately, you can still get this after we start and the discount is over. But there is no guarantee that I'll be the one that will deal with you here. So that's what it entails to get on this and reverse this problem, the diabetes and hypertension. So it is entirely reversible. Spent a whole week to talk about this. So I think we have an exhaustive information. Now it's time to take action. So ah, oh, this is the problem. Probably when you gave birth, probably when you had an accident. People have said different things that has triggered this. That one is gone. The issue now is to come and resolve this problem once and for all. And I've explained exhaustively how to deal with it. And now it's time to take action to solve this. Now, those who take action fast again, I'm going to be giving you a ebook for free. And that ebook is very valuable. When you pay, I'll give you the ebook. That's when you join the program after everybody has come together. And let me plead, okay, I'll send that information personally to those who join the program. So that is it. And that is the end of today's program. Thank you for taking out time. So if you're interested in joining the program and maybe you are seeing this video later in the future, you can reach me. If you're on YouTube, just look at the comment box below. You will see maybe the link to follow, or you can go to www.smartmedicalprograms.com/premium, or you can send me a message, just a message, don't bother to call, or send me a message on WhatsApp on 0803 50 50 222 and let us know you want to join the program. So this discount might not apply then, but you can still send, and whatever the program goes for then, we'll let you know. 0803 50 50 222. So if you're already part of our free program, you can always reach me and you should come on board immediately. Yes, for those who might want to take action immediately and pay, sorry, let me give you the details on how to make payments. And I think you should take that action immediately. This discount that I'm talking about ends, yes, that discount ends maybe in another 2 to 3 days, but you don't even have to wait for 2 to 3 days, because if you have any concern now, we can start addressing it even before the program kickstart fully. So the account details to pay to is, the account name is Smart Medical. The account name is Smart Medical, and it's a GTB account, and the account number is 0479870792. 04. So for those who might want to write it down, let me call it again. The account number is 0479870792. 0479870792. Please go ahead and make the payment, then send me a message on 0803 50 50 222. So that message can be the evidence of your payment or your account name. Send it to me on 0803 50 50 222. And once again, the account to pay to Smart Medical Limited, account number is 0479870792, and it's a GTB, Guaranteed Trust Bank. Thank you for your time this evening, and we can now take questions. Thank you.